OB-GYN Chats broadcasting live at Demoshuya Suites. It's always a tongue twister, but I got it this time. Dr. David Emvula, we are halfway through the year. Welcome.
Unbelievable.
I know.
It has been such a busy year, so and
Yeah.
it's very much really unbelievable that we're already in June, halfway
Yeah.
into the year.
Yeah.
But we are keep going on, and so far so good.
We're pushing. I see doctor's nice and warm. I'm a bit warm-blooded today.
Winter is upon us.
It is.
Yeah,
It is.
yes.
So tonight it's quite sensitive because as an obligation of OB-GYN, we also take charge of the narrative with what's happening. When we speak about teenage pregnancy, there are mothers that are watching. There are those that have children as teenagers. First and foremost, let's place it in context. Do we have a high number of teenage pregnancy rates in Namibia?
Very much. It's really quite very disturbing, like you highlighted. And perhaps the most disturbing statistics that we see is that it appears to be that teenage pregnancy is on the upward or rising stage, and we're seeing more and more young mothers that are coming to our hospitals, especially in the state sector. And that is quite disturbing, and it's really high time. I think we need to do something, because I would believe that we are in a crisis stage when it comes to teenage pregnancy.
Of course, prevention is better than cure. That's why at the end, it's by saying we've got a problem. What is the solution? So they always say ABC, abstinence, etc., etc. Why do you think that teenagers continue to still be on a rise with teenage pregnancy? What are the common reasons?
So it is multifactorial, I would say, and perhaps would rather to say to break it into from the multifactorial, starting with we need to look into aspects of the changes in the context of growing up. We are exposed to that era of ABCs, abstain, being faithful, and condomizing, and there was a lot of awareness, especially in that. And I must say that we are not seeing that in this current age generation, whether it's on the national TV, whether it's in the newspaper. Not really sure what is happening in the schools, and it's something that perhaps one of those solutions that we really need to look into, whether what are we doing in schools when it comes to that. And the other one, perhaps I would say, from it comes from the generation, whether we live in a completely different era. There is accessibility to especially in the widestream media, in online platforms, and kids are exposed to many all sort of anything that you can believe related to sex, and they are probably prone to experiment. And when they see these things, and perhaps that's one of those, I would believe there is also issues related to economics, hardships that are encountered, and that may also influence and draw young girls into these relationships, and then which may end up being end up being the result of a teenage pregnancy. So I would really say it can't really be one point factor, but it's multifactorial, and it's perhaps something must be done to really see and even really understand what is the main issue that we are seeing more rising teenage pregnancy.
And unfortunately, Doc, when you read in the newspapers, much of it has to do with rape, and especially senior people with underage children. I wish we had another talk just about that in terms of law, regulations, etc. But that's another discussion for another day. Somebody that's watching, impacts could be on them emotionally, physically, but not that. What impact does it have socially and economically?
Okay, socially, obviously, it starts with the stigma. These young girls that are pregnant, obviously, it brings a lot of stigma attached to it. And that's why most of the time, even when they know that they are pregnant, they would want to conceal that pregnancy by any way that they can, so that no one really realizes that they are pregnant, not knowing that eventually the baby will come one day. And that is really quite a big challenge, that the stigma. And also that comes with being pregnant. The other issues that is also related is the consequences that you might highlight, especially the economics. We know very much well that most girls that end up with teenage pregnancy, they do not go on to complete their education, and without education in modern age, these girls miss up on the economic opportunities to be employed and be productive members of the society one day. And perhaps that is the most serious consequences that we see. And that is also not the same for the males. If you look at it, that's the way that if you have a teenage a girl who is impregnated by a teenage boy, the teenage boys they continue with their education, and even if the girls continue with the education and they go on to go give birth and come back, it is not the same because the consequences obviously is always
They differ.
They differ. They are the ones who need to go now through these issues of depression, to deal with the shame that may come with other health implications such as depression, and they may not be as productive members compared to the consequences. And they, at the end of the day, they are responsible for their child. And as you know, that most of the time, this child will always be with their mother, and at the end of the day, they bear more consequences compared to boys. And perhaps these are some of the things that really need to be addressed as we speak about gender equality.
Yeah.
And as a way maybe of raising awareness also to boys that people should also, if we want gender equality, then everyone should account for the consequences of the pregnancy.
And the conversations start right here, bringing awareness to it. This is going to be a controversial kind of a question because recently we've seen corporates not praising, but giving aid to teenage, pregnant women, assisting financially. Some on social media would say that it seems like we're praising teenage pregnancy. Some other people would be like, it's happening, so why don't we support teenagers? So I'm asking the question for the mere fact is that when we say, how do we support teenage pregnancy without idolizing it and also making it seem okay, but the community must help teenagers when they find themselves in this predicament?
Indeed, and it requires all of us to get involved, the communities where these children are coming from. And we must also be careful, like you're rightly saying, that it should not be seen as a way of surviving and getting money. Because I know, for instance, in South Africa, our neighboring country, there is what we call childhood grant. So if you have a child, the government give you support. And also in Namibia, there is also there are ways in which the government also support the mothers who cannot afford. So it should not be seen as a way or a shortcut to get a way of getting an
Incentive,
income, incentives to and but rather to really support from the union. So within the community, we should recognize that teenage mothers need help. They are not ready to look after the children, whether it is from the mental aspects or whether it is from the economical aspects, because they are not yet in the productive members of their society. They were supposed to be in school. And it is up to us to help and raise the child and also break the what is known as a circle of poverty. It is very much well studied that if you are a child to a teenage mother, there is a high chance that that child who is a result of a teenage pregnancy is also likely to end up as being a teenage mother themselves, or what we call as a teenage. And we need to find ways to break that we call the circle of poverty, and that comes through to getting involved at the community level, trying to educate more and support these mothers to really raise a child who is born out of the teenage pregnancy to become even better and the productive members of the society.
Doc, we could make this very spiritual by talking about, what religion accepts or doesn't accept prior marriage, but it's happening. We see the result thereof. And having said that, cultural norms, cultural stereotypes, especially if you have a child out of wedlock, there's stigma around it if you are a teenage, if you're pregnant and you're a teenager. How do we as a society have these healthy debates on stopping some stereotypes? I only gave one example. There are many. What are out there apart from that? And how do we stop the stigma itself?
It has to come with firstly, we need to go back to understand our roles, which is our cultural settings. We know very much well that in some cultures it is very much acceptable for someone who is a teenager to fall pregnant, to conceive, or even to get married. But we also need to be conscious of the law. Like you rightly said, one of the issues related to the law is that by law, any pregnancy beyond the age of 16 whether it is considered a statutory rape, especially if there's an age gap of more than 2 years. But what we see is that you see young girls that are conceiving with an adult that are older men, and that by law it is a statutory rape. So those are the issues that we need now to understand, that we are living in a completely different era, and perhaps we need to do more race awareness, that young girls should be given an opportunity when they're at school to thrive at school and focus on their education, and they should not be in. We should try to integrate these issues of cultural, integrating the possible marriages or arranged marriages, if you say in certain communities, that should be delayed at least to after girls have completed their education and they are really ready to make their choices, and also to be integrated into the economic players in the as we know that most of the time when they end up with teenage pregnancy, they tend not to complete school, and it has very been well proven that most of those patients don't go back to school, and they don't end up being members of the productive members of the society. You mentioned about religious; they also have a big role to play, and we need to start engaging openly about this discussion of sexual health, not only in schools, even at religious levels. In the we know most churches after religious and after pregnancy, they before maybe they take their kids for baptism, they need to attend classes. But I think that is already a bit too late. We perhaps really need to start engaging that, because the reality is that young girls and boys, the modern age, engaged in sexual activities earlier, and there's many studies to prove that the age of sexual debut is getting less and less, and those are some of the issues that we also need now to study and understand why are the young girls engaging into and boys engaging into sexual activities at such an early young age.
And I think it now links us to our last question to rope everything in perspective. And please do note, you're also more than welcome to give your comments, your suggestions, your feedbacks. How do we prevent teenage pregnancy? We've been preaching about it for years. It seems like the numbers are going. Where are we going wrong? And what can we do, somebody watching, to change the norm?
We know very much well that prevention is better than cure. But in terms of prevention, I would say there's rather looking to a multi factor approach, or multidisciplinary approach. And that includes us as the healthcare workers. We need to do more in engaging young girls and even promote sexual education, whether it's on public platforms such as national television, media, and also even going to schools. Perhaps we need to start going and really educate young girls about sexual health, and so that they make right sexual health choices. That we need to do that. We also need to change our attitude towards the way we perceive teenage girls when they come to the hospitals, especially if they want to seek contraception to prevent pregnancy. It should not be seen, and we have had cases where young girls come to the hospital, but our healthcare workers would say you are too young to be engaging into sexual activity. But how can you say that if someone is coming and say I need it? We need to be more patient friendly and make sure that the environment is conducive for these young girls, and if they want contraception, then we should offer it to them, because we know that it is in the benefit interest, and not to really discourage them to feel like I don't want to go there. That's from the healthcare system and aspects. That's one of the few things we really need to do. In terms of it is like I said, it requires multidisciplinary. The community, which is parents, we need to get involved, and also need to accept that the reality is that we're living in a completely different era, and we need to start having discussions with our children regarding sexual health, and so that if we empower them from home, like the way we tell them that do not take someone's stuff at school, do not touch other. It should be the same way that if you are to engage into sexual activity, you rather delay, and if you are true, this is the right way to do it. So it should start at home. So parents and communities at large do have a big role to play. And then the other aspect is also the government, and the government is from two aspects, which is the education, which is schools. And schools need to get engaged, and we need to start educating girls and empower them so that they really make correct sexual choices. And then the other one is the law enforcement. They also need to come into on board to really make it out clear and pass on the message, raise public awareness that if an older person is engaging into sexual activities with a teenage, that is considered to be a criminal offense within the Statutory Rape Act, and that can be one can be criminally charged and even face imprisonment. And those are some of the multidisciplinary teams that really need to be engaged. And if we are to really come to end and hopefully stop this teenage pregnancy crisis that we are currently facing at the moment.
Very well wrapped up. Doc, we can have another hour just to discuss on this, and teenage pregnancy goes with different segments. But thank you so much. Cheers. We appreciate your knowledge
Yes,
and
indeed.
wisdom.
Need to have coffee.
Yes. Thank you so much. You can always subscribe, like, and share this link with someone that you know needs to hear this. Until the next month, thank you very much. OB-GYN Chance.